Hello everyone, welcome to Rehabilitation Sciences Group YouTube channel. And we are here with Dr. Tanvi Sethi. She'll be talking about menstrual health and the role of physiotherapy. Dr. Tanvi is certified women health and personal health counselor practitioner. She has done her BPT from Institute of Physically Handicap and Masters of Physiotherapy for Amarjati Institute. Currently, she is working with as an assistant professor at PDM University, Bahadurgarh, Haryana, and she has also completed fellowship diploma in pediatric uh, rehabilitation. She has a special interest in menstrual and women health, and she'll be talking today about the menstrual health and role of physiotherapy. So, with this note, welcome Dr. Sethi on this platform, and you can start the session now, please.
Thank you, Dr. Pandey. It's great to be on this platform and presenting this menstrual health. It's the very least talk about topic, and it's a new field to explore for the physiotherapist. We can do a lot for women health if we know the right path, if we know what is happening with the woman's health. So starting with the topic, we are talking about the menstrual health and what is the role of a physiotherapist. We come across a lot of problems during our menstrual days, PMSing, pain in the abdomen, amnoria, females suffering from PCOD and PCOS have different set of pains during the menstrual cycle, endometriosis. There are n number of diseases that are surrounding the menstrual health, and you bleed every one lunar month, every 28 to 30 days we are bleeding, and we have this problem which we never come across. We don't talk it with anyone. So with the idea that a physiotherapist can help with the menstrual health, it can definitely uprise the health of the woman in the country. So today I'll be covering 6 topics. That would be anatomy of a female reproductive tract, followed by what are the roles of hormones, what actually is menstruation, what are the 2 cycles that run parallel in a female body, how should you maintain the hygiene during the menstrual days, what are the disorders in menstruation, and how as a physical therapist you can help decrease the pain or overcome this problem a female faces during a menstrual cycle. So starting with the anatomy of the female reproductive tract, when I talk about the external genitalia, we have mons pubis, which you see as the outside of the female vaginal or a female genitalia part. Mons pubis is made up of a fatty tissue and it's shaped like an upside down triangle. It is covered by the pubic hair. They act as a protective barrier, reducing the friction during the sex. It traps the dirt, the debris, potentially harmful bacteria to enter into your vagina. They also keep your genital warm. If you find out there is too much of hair growth in your pubic area, then it could indicate PCOS. And if there is a less hair growth in your pubic area, it could be because of a decreased testosterone level. Growth and thickness of the pubic hair, it varies from individual to individual. It is different from each girl to the next girl. The hair follicles, they produce a sebum, an oil which actually prevents bacteria from the harmful bacteria from reproducing. Other than them, when you sit and open your legs, you can see the 2 lips. The outer lip, the outer fold of the fatty skin is called the labia majora. It is a padding to the sensitive part of your inner vulva, which is your labia minora. If you can just see in the picture, it is very clearly shown the labia majora, and the inner lip, that is the inner fold of your external genitalia, the labia minora, which again protect your vaginal opening. Clitoris, it's a triangular mass of erectile tissue. It is homologous to a male's penis. Then we have the urethral opening, the vaginal opening. If you can see in the photo, it's clearly visible, the urethral opening and the vaginal opening. If we can clearly see in this diagram is mons pubis, we can see the pubic hair, clitoris, the urethral orifice, the vaginal orifice or the vaginal opening. the hymen, which is a mucosal tissue layer which protects again our vagina from any kind of bacteria, dust, dirt, anything. Then we have these two glands which I have marked as circular. The first is the skinny gland duct, which helps in female ejaculation and orgasm. And the second is the Bartholin gland, which helps in the lubrication. Once we are done with the external genitalia, next come is the vagina. A vagina, it's a closed muscular canal. It's usually closed when at rest. It keeps the vagina, it protects the vagina from the external dirt. It is stretched during the penetration and the time of sexual intercourse, or it is stretched when you are inserting a tampon. Again, the vagina is lined with a special skin cells. This The outer layer, the inner layering of the vagina has mucosa. It has skin folds which have the ability for the vagina to stretch. So when we know in the during the childbirth, the vagina can expand. It can let out the baby to come out from the vagina. So it has the ability to stretch. The function of the smooth muscle is that it helps to move all the discharge from your uterus to come towards the vaginal opening. So, and the vagina, the normal pH level is 3.5 to 4.5. The best thing about the vagina is that it has a self cleansing mechanism. So we need not do washing or anything. The products that are available labeling that it is for maintaining the vaginal health or maintaining the pH of the vagina, it is nothing like that. We never use any chemical to clear the vagina. We don't actually clean the vagina. It has a self cleaning mechanism. All we can clean is the external genitalia part. The next is the cervix. Cervix is a connecting canal between the uterus to the vagina. It has two orifices, external orifice, which is the connection between the cervix and the vagina, and internal orifice, which is the connection between the uterus and the cervix. It's a cylindrical shaped neck of the tissue. The cervix produces cervical mucus that changes in consistency during the menstrual cycle to prevent or promote pregnancy. So how is our cervical mucus? Is it how alkaline it is or how thick or thin it is? Uh, that will determine how the transport of the sperm's gonna be. If the consistency of the cervical mucus is thick, it would prevent the sperms to um, mobile up to the uterus. The sperms would find it difficult to be transported to the uterus, whereas during the ovulation time, the cervical mucus, which is the thinnest at that time, it is easy for the sperms to transport. So during the childbirth, the cervix dilates widely to allow the baby to pass through. Talking about uterus, it's the secondary sex organ of the reproductive system, ovaries being the primary sex organ. It is within the uterus that the fetus develop during the gestation. During the 9 months, the fetus is embedded in the uterus. It grows inside the uterus, and the uterus has three layers. From innermost to outermost, if I name them, is endometrium, followed by myometrium, and the outermost being the perimetrium. When we talk about the menstrual cycle, it is we are concerned with the endometrium. The endometrium is the lining which sheds if the pregnancy is not taking place. Okay, fallopian tubes and the ovary. So if you can see in the diagram, on the right hand side is the ovary. So ovaries has two sides which are released every one lunar month, every 25 to 28 days, which varies from individual to individual. So the ovaries releases the oocytes at midpoint of each menstrual cycle. Hormones like estrogen and progesterone, they are all created here in the ovary. Once the egg is released from the ovary, if you can see on the left side, the fallopian tube has fimbrae. It has finger-like structure which catches the oocyte and transport it to the uterus for the sperm to mate with the ova. Okay, female reproductive cycle. We have two cycles that are going on in the body. One is the ovarian cycle, and the second is the menstrual cycle. Ovarian cycle is the release of ova, that is somewhere around the day 11 to 18. It is again variable from individual to individual. The menstrual cycle is when the egg is not fertilized, the endometrium sheds and bleeds from, it would be from day 1 to day 5th. So talking about what is menstruation, it's it's the process in a woman of discharging blood and other material from the lining of the uterus at intervals of about 1 lunar month from puberty until the menopause, and except during the time of pregnancy. The typical cycle is around 28 days, which may be different from every female to every female. It may be as short as 21 days or as long as 40 days. But again, it doesn't matter how short or how long is the cycle, it should have been regular flow. Okay, so this is a photo which I found very interesting over the net. It completely describes how is your ovarian cycle and your uterine cycle going hand in hand. What is happening at the ovarian cycle and how it is connected with your uterine cycle. So at the starting of the ovarian cycle, or when my menses are over, somewhere around day 6, day 7, my estrogen is at the end. There is a drop in my estrogen level. Then the hypothalamus, it stimulates the FSH, which starts the follicles, which helps the follicles to grow. From a primary follicle, it develops to a secondary follicle, followed by a Graafian follicle. Once a Graafian follicle is produced, which is the follicular phase, the estrogen starts to rise up. And because of a sudden surge of the luteinizing hormone, LH, there is ovulation. So if you can see in the photo, the LH is smacking the ovary to release the ova. So once the ova is released, now it waits for the sperm to come and mate. By the time the Graafian follicle, which has already released the egg, converts into corpus luteum. Once the corpus luteum is formed, the progesterone is again at the high level. Corpus luteum, it has luteal cells which releases the progesterone. If the pregnancy takes place, the progesterone levels remain high and your lining of the uterus is intact. If the pregnancy does not take place, the corpus luteum is converted into corpus albicans, and the endometrium thickening starts to thin, and finally it sheds again, causing your second or your menstrual cycle. If we compare the first part, the ovarian cycle part, with the uterine cycle, when the estrogen level was low, we can see that there was a very thin endometrium lining. It is about 2 mm thick when we are starting with the follicular phase. As soon as the follicular phase starts, the estrogen is at its peak at around 11th or 12th day. The thickening of the endometrium starts to build up. It's approximately around 4 mm by the time of ovulation. When when the Graafian follicle is converted into corpus luteum, the thickening again starts to increase from 4 mm to 6 mm. Now the endometrium is preparing itself for the baby to be implanted, for the fertilized egg to be implanted. If you can see, there is you can see arteries, the spiral arteries, they become tortoise during our luteal phase. And if the pregnancy does not occur, if there is no mating of the ova with the sperm, the corpus luteum, when it converts to corpus albicans, again the thickening of the endometrium starts to thin. Again, from 6 mm, it comes back to 4 mm and 2 mm, and finally sheds, resulting in the menses. So in the proliferatory phase, that is influenced by the estrogen, the thickness of the endometrium rapidly increases. And in the luteal phase or the secretory phase, that is influenced by our progesterone, the lining becomes highly vascular and edematous. But if the pregnancy does not occur, it finally starts to shed. So there are 4 phases of the menstrual cycle we have talked about. The menstrual phase, that is from day 1 to day 5. Again, it varies from a female to female. pre-ovulatory or proliferatory phase, uh, or we call it as a follicular phase where the endometrium thickening was 2 mm. Ovulation phase, that is the from day 10 to day 14. Uh, and then that is the post-ovulatory phase. Fourth phase is luteal phase, when we have the corpus luteum, which is releasing the progesterone. In this photo, we can compare that during ovulation, which of the hormones are at peak, which hormone is playing a role at what time. So if I talk about the ovulation phase or pre-ovulatory phase, around day 10, your estrogen is at peak, followed by an LH surge. Once there is an LH surge, the ovulation takes place, the ova is released from your Graafian follicle, followed by a sudden decrease in your LH and FSH. Once there is a decrease, once the LH and FSH are inhibited, the progesterone and estrogen are again on a rise. Progesterone remains high till the time the corpus luteum is intact, and as soon as the corpus luteum is converted into corpus albicans, again the endometrium lining starts to shed. So in the uterine cycle phase, we can see how it is thin in the follicular phase and how gradually it starts to increase in thickness, how the spiral artery starts to become more taut during our corpus luteum time or during the luteal phase. There is an increase in the basal body temperature for around 0.5 degrees Celsius to 0.8 degrees Celsius during the ovulation phase. A lot of women, they complained of abdominal cramp during their ovulation time. Some of them complained of body ache or rise in temperature, that is again related with the ovulation. And the best way to find out that you have ovulated or you have entered your ovulation phase is to check for your cervical mucus, which is very thin and slippery and transparent at the time of ovulation. So it helps the sperms to easily transport through that thin, less consistent or slippery cervical mucus to mate with the egg. So we have talked about 4 hormones: FSH, LH, released by the anterior pituitary, and estrogen, progesterone by the ovaries. So FSH and LH, both of them, the FSH helps in the follicular growth in the ovaries, and LH, the surge, causes the ovulation. And estrogen, progesterone, both of them are responsible for the thickening of the uterine lining, and both of them inhibit the FSH. We have seen in the previous picture, as soon as the estrogen and progesterone starts to rise, there was a sudden dip in the LH and FSH. Okay, so with menstrual cycle, then we need the menstrual products to keep us healthy, to maintain our hygiene. The maximum used menstrual products are sanitary napkins or pads. 30% of the population worldwide uses tampons, and only 5% uses the menstrual cup. The remaining 15% population uses different products like period panties or menstrual discs. There has been a lot of debate on which product to be used. Sanitary napkins are better, or tampons, or menstrual cup. I would say it depends on an individual to individual, whatever they are comfortable with. But in my opinion, the menstrual cups are far better as compared to the sanitary napkins when we talk about the hygiene part, when we talk about the cost effectiveness. And a lot of sanitary napkins, they add up to the environmental hazards. If we go to any public toilet, we can see the sanitary napkins littering around in the area, which again could be one cause of the infection. So if you can see in the figure, is the first one is a menstrual cup, a tampon, and a sanitary napkin. So somebody who has just started with the periods, that if the hymen is intact in a 14-year-old girl, then sanitary napkins are the best to start with. And once the hymen is broken, because of the sexual intercourse, or in a young female because of any sports or activity, then they can definitely switch to tampons or the menstrual cups. The sad part of talking about the menstrual cycle or the menstruation is that only one in every two girls in the world have knowledge about, in India, have the knowledge about menstruation before their first period. So I believe before they have their first period, every mother, father should educate their girl about the menstruation, menstruation related health and hygiene. Girls and women have very less. They have no knowledge about how a reproductive tract infection could be caused because of the ignorance. Sometimes because of the improper sanitation, because of not availability of the public toilets all around, the sanitary napkins are used for more than 10 hours, which again result in the formation of the fungus and bacteria over your sanitary napkins. If you remove your sanitary napkins from after 6 to 8 hours, you can see the blood has started to discolor. It starts to become green. This is the fungus infection that has already started taking place on your sanitary napkin. So sanitary napkins, they are advised to be changed every 4 hours on your heavy menstrual days, and they should be changed after every 6 hours on your light menstrual days. uh, with the menstrual cups, you can wear it for as long as 10 to 12 hours, depending upon your flow. If you have a normal menstrual flow, you can wear it for 10 to 12 hours. Whenever you feel that the cup must have been filled, you can just take out your menstrual cup, wash it, and you can reinsert it. We need to educate the women, and we have to make them aware about the environmental pollution and health hazards that can be associated with the sanitary napkins and tampons. Awareness should be created to emphasize the use of reusable sanitary products, for example, the menstrual disc or menstrual cups, as compared to the sanitary napkins. So change your pad every 4 hours. If you are using the reusable pads or the period panties or a cloth pad, it should not be used for more than one menstrual cycle. It is absolutely fine using the reusable pads, but only for 10 times, for 10 continuous changes, washes. It is not supposed to be used after 10 washes. You have to keep your vulvar area clean. If you have a lot of pubic hair, then you are supposed to wash every time you go to pee. And you are supposed to wear comfortable and clean underwear, preferably cotton underwears. Any tight underwears or satin underwears, the fabric that doesn't allow your skin to breathe, can lead to infection. A positive perception about menstruation and good menstrual hygiene practice safeguards the health of post-pubescent females by reducing their vulnerability to reproductive and UTIs. So, if you have a positive perception about menstruation, if you are maintaining a good menstrual health, it would definitely help you to be at bay from the reproductive and urinary tract infections. So the next generation of the menstrual product would be cups, the menstrual cups that would be paired with the smartphone. So we initially started using the leaves, then came the cotton pads, then we progressed to pads or the normal tampons, and now in the coming future, definitely it's the menstrual cups that are linked with your smartphone, which, you know, the smartphone is going to beep and tell you that you are 58% or your menstrual cup is 70% filled. You are supposed to pull it out and empty it and reinsert it. So this is the new gen idea of creating the menstrual cups that would be paired with the smartphones. Okay, so let's come to the main important part, that is the menstrual disorders. A lot of females during their menstrual cycle, before the menstrual cycle or after it, they complained of pain in the abdomen. They complained of premenstrual syndromes, mood swings, irritability, sleep problems, acne and pimples, bloating, depression. So we're gonna discuss a few menstrual disorders. First and the most common is the premenstrual syndrome, which in our normal language we call as mood swings. So it's an unpleasant or uncomfortable symptom during your cycle that may temporarily disturb the normal function. The PMS symptoms, or it could lead to depression, anxiety, irritability for a shorter period of time, bloating, fluid retention, skin problems like acne, headache, diminished libido, changes in your appetite. A lot of people say we eat a lot during our menstrual cycle, whereas a few people, because of the bloating, they don't feel like eating anything at all. And hot flushes. Amnoria, that is a complete absence of the menstrual periods for more than 3 months of menstrual cycle. They are basically of two types, the primary and secondary. Primary is definitely when your menstruation has not begun at puberty. Secondary could be because of any of the physical reasons, any medical reason, or it could be because of the mental health. Stress is one of the factors that can lead to amnoria. And when I talk about the physical causes, they could be obesity, a eating disorder, or ovulation abnormality, a birth defect. Somebody having a thyroid disease can have amnoria. So how amnoria is usually managed, that you were having normal periods for 6 months, then started with the irregularity, and eventually you have not bleeded for more than 2 or 3 months. That is the time when you need to seek the help of the gynae. Other symptoms for the amnoria could be weight gain, change in the breast size, or a milky discharge, acne, hair loss, increased facial hair growth, headache, or vision changes, and pelvic pain. Management could be steps to reach a healthy weight gain and to maintain that weight. Even if you are underweight, you are supposed to gain an appropriate weight. And if you are overweight, then you have to reduce the weight. If the amnoria, if your mental health is the cause of amnoria, then interventions definitely needed to reduce your stress, relaxation exercises, breathing exercises. If you are an athlete, you have to modify the way you train. There was a study, a Korean study on female cadets, which was found that they were extensively training and their appetite or their diet was not appropriate according to the training they were taking, which was found out that the cause of amnoria in most of the female cadets was because of the excessive exercise or excessive training. So if you are an athlete or if you are working on high intensity exercises, then you have to balance it out with your diet. Medical treatments like estrogen replacement therapy, medication for PCOS. If you have any scar tissue in your uterus or a pituitary tumor, then you have to surgically get it removed. Okay, again, one of the most common complaints of female during the menstrual days is dysmenorrhea, that is severe and frequent menstrual cramps and pain. The cause of dysmenorrhea is dependent on if the condition is primary or secondary. With primary dysmenorrhea, women experience abnormal uterine contraction resulting from a chemical imbalance. And secondary dysmenorrhea, it could be caused because of a medical condition, for example, endometriosis. And other possible causes could be a PID, a uterine fibroid, any abnormal pregnancy, a recent miscarriage or an ectopic pregnancy, any infection in your reproductive tract, any tumor, polyps, cervical polyps in the pelvic cavity, any of these can also cause dysmenorrhea. So we have to distinguish the pain of dysmenorrhea. Is it a normal menstrual cycle pain, or is it related with any other medical condition? So symptoms of the dysmenorrhea include cramp or pain in the lower abdomen, low back pain, nausea, vomiting, diarrhea, fatigue, weakness, fainting, and headache. Definitely relaxation, a balanced diet, a warm shower, heating pad, or a hot water bottle over the abdomen or lower back will definitely help reduce the pain on your lower abdomen and back. And exercise part we'll cover in the PT rehab. As far as the pain medication is concerned, I prefer to suggest or prescribe my clients to go for a muscle relaxant rather than going for a pain medication. Next is PCOD or PCOS. We have commonly come across these two terms. It is on a toll these days in India, but there is a big confusion, PCOD and PCOS. So these two terms, they are not interchangeably used. These are two different terms. When I talk about PCOS, it's a metabolic disorder. And when I talk about PCOD, it is a lifestyle disorder. So uh, it's not interchangeably used. I know the three words, the polycystic ovarian is same, but syndrome and disorder are two different things. So disorder is again associated with your lifestyle disorder. So in PCOD, it's a more severe condition than PCOD, PCOS. In this condition, the ovarian produce a higher quantity of the male hormones. There is a formation of the follicular cyst in your ovaries every month, which actually stops the release of the egg there. So there is amnoria. There is literally no ovulation in females which are going through PCOS. But when I talk about PCOD, it is again your mature, partially mature eggs, they turn into cysts. But one of the reasons for PCOD is junk food and overweight, whereas with PCOS, it is just the male hormone, it is just the androgen, or it's just the hormones which are not in level, which is causing PCOS. But PCOD, it is, we have actually, you know, just got ourselves into that situation to develop PCOD. We are eating junk food, we are overweight, we are stressed, we have zero physical activity. So PCOD, we have actually invited PCOD. And PCOS, which is something which is we don't want to invite, which is actually acquired because of the hormonal imbalances. If I talk about the infertility part, PCOS, women with PCOS, they have to be treated gynecologically to conceive. But PCOD, you can still conceive. The infertility rate is very low with females concerned with PCOD. So PCOS is more serious condition. PCOD, therefore, PCOD is more common. About 1/3 of the women around the world suffer from PCOD, whereas PCOS has still a lesser number. PCOS has serious complications. Women could be at a high risk of developing diabetes, high BP, cardiovascular issues, obesity, or they can even end up with endometrial cancer if the PCOS is not treated at the right time. Talking about endometriosis, it's the growth of your endometrium, the lining that was the innermost of the uterus, now is growing outside your uterine cavity. It is growing anywhere over the uterine cavity, outside your fallopian tubes, outside your ovaries. And they shed on a normal, regular basis how your endometrium inside the uterine cavity was shedding. So pelvic pain is one of the most common symptom of endometriosis. Other symptoms could be painful periods, extremely painful periods which you were not experiencing before. One of the common findings with endometriosis could be heavy menstrual bleeding, or you can even bleed between your two menstrual cycles. So when you are expecting your date, even before your actual menstrual cycle has to start, you can bleed in between also. One of the reasons could be endometriosis. Infertility, pain following a sexual intercourse, again, could be indicative of the endometriosis. Discomfort while bowel movements and lower back pain that may occur at any time during your menstrual cycle. So, pain in your lower abdomen or discomfort with the bowel movement, pain following the sexual intercourse, you can distinguish from endometriosis and the normal dysmenorrhea pain. Okay, perimenopause. Perimenopause is again it's actually a menstrual disorder. Before a woman is actually in the menopause phase. The woman is approaching the menopause, it's the perimenopause phase. So an average perimenopause lasts for around 3 to 4 years and usually starts from mid to the late 40s. It could start a decade earlier, it could start in mid 30s, it could start in late 30s. During premenopause, a woman's menstrual cycle will become irregular. They may experience light or heavier than the normal bleeding, and they could also across the intermittent spotting in their perimenopausal phase. So it's an indicative that they are approaching the menopause. Perimenopausal women, again, they have a lot of hormonal issues. Their stress level is high. They again go in depression. The body is changing drastically. The hormones, your estrogen level starts to drop down rapidly 2 years prior to your menopause, and again it stabilizes after 2 years after your menopause. Progesterone is also decreasing since there is a limited egg release and there is only a few eggs have to be released. The corpus luteum is not taking place, so progesterone also starts to decrease, and the lack of progesterone can result in irregular, heavier and prolonged menstrual periods during the perimenopause. The common symptoms could be hot flushes, night cold sweats, anxiety, mood swings, sleep disturbances, fatigue, vaginal dryness, discomfort during the sexual intercourse, frequent and urgent urination. They could all be the symptoms of a woman that is approaching the menopause. There is a significant weight gain during the perimenopausal time, around zero point 0.4 kgs per year. Lack of exercise, unhealthy eating, lower levels of education, insufficient sleep, family history of obesity, they also may contribute to the weight gain in the midlife. And the treatment would be, again, firstly, it would be changing your lifestyle factors to improve your diet, inculcate a regular physical activity to maintain an optimal body weight. And if these things, if the lifestyle changes are not helping out, then we'll go for the hormone therapy. Okay, so coming to the main important part, the physiotherapy management. The key points to the management would be four. We'll be considering not just the exercise or the electrotherapy part. We have to take care of the stress levels and we have to take care of the diet of the female client we are dealing with, having any of the previously talked about menstrual issues. So starting with the diet part, the nutrition part, menstruation, it actually affect the quality of life, the fertility, emotional distress. In our country, 43% of the females, they don't turn up to their work on the very first day of their menstruation cycle, because of any XYZ reason, because they are PMSing or they have dysmenorrhea, a lot of pain in their abdomen, they feel fatigued, weakness. And the worst part is that they have actually adapted to live with it. Either they just take a hot pack or they just lie down in the bed for a long day. They never come up, they don't talk to anyone, they don't never see a doctor for these issues. But again, they could be a problem in the future when they are planning to conceive. They could have any of the reproductive or urinary tract infections. So, talking about the nutrition part, vitamin D deficiency, it has been associated with the menstrual irregularity in women that are suffering from PCOS, especially. So, vitamin D, the best source is sunlight. So, we can take a sun bath, we can eat salmon, tuna, fish oils we can take. For vegetarians. Unfortunately, the mushrooms are the only ones that are exposed to sunlight during their growth. So, they are good source of vitamin D. Other than that, definitely we can go for supplements for vitamin D. And again, shortage of calcium that leads to the distress during the menstrual cycle. One of the common reasons of abdominal cramps is the shortage of the calcium in the body. So dairy products, beans, fishes, they are a good source of calcium, and they should be definitely consumed at least during your menstrual days. So a loss of blood affects your iron and folic acid stores. So it is recommended to have a iron-rich diet along with vitamin C, because its iron is best absorbed when taken with vitamin C. So you have to consume iron and vitamin C. They are the good sources of iron could be liver, lean red meat, poultry things, tuna, salmon. For vegetarians, they can have dates, rice flakes, lentils, and beans. Vitamin C sources, any citrus food will grow other than you can have broccoli, you can have capsicum, Brussels sprouts, whatever and is available, but it should have been rich in iron and folic acids. You can have folic acid supplements as well, but you need to talk to your gynae for what amount of what mg of folic acid supplement you are supposed to take. Otherwise, a good source of vitamin folic acid is present there in beef liver. It's there in white rice, Brussels sprouts again, avocados, and raw spinach. High fiber diet is inversely related to the PMS. So the higher is your fiber in the diet, the less would be the mood swings, the less would be the bloating. If you are eating a high fiber diet during your menstrual days, so you will experience less of the bloating during those days. Healthy fats that are crucial as they ease the menstrual discomfort by relaxing your uterine muscles. You can have a good source of omega-3 and omega-6 fatty acids. You can have flax seeds, canola oils, pumpkin seeds, sunflower seeds, walnuts. Everything is easily available in these days during the market. Otherwise, you can ask your clients to, the next time they have pumpkin, they can just wash on the seeds and store them for a very long time, and whenever they are menstruating they can just crush the seeds, have a spoon of these pumpkin seeds or flax seeds with a glass of water, or they can just mix it in any of the salad or sprouts they are taking. So these healthy fats, they will definitely help to relax your uterine muscles and will bring down your uterine cramping or your abdominal cramping or your abdominal pain that you experience during the menstrual days. So you are not supposed to binge on fast food during your menstrual days. You are supposed to decrease down your dessert intake. So excessive sweet fattening food consumption and post-menstrual distress have a, actually a linear correlation. So there is a lot of post-menstrual distress when we binge eat during our menstruation days. Moderate consumption of tea and coffee, it is okay, you can have. You are supposed to have three major meals and you are not supposed to skip your breakfast. Have fruits, tea, dry fruits in between. One important thing that you have to drink plenty of water during your menstrual days between the meals, and avoid caffeine, alcohol, tobacco, sugar, and fatty foods. Stress management, again, for people who are having amnoria issues or females which are in their perimenopause time, stress management is one of the important factors. You can inculcate the habit of breathing exercise. You can teach them breathing exercise to reduce their stress. They can have lukewarm water bath with Epsom salt. They can just have a hot water shower, relaxation exercises, meditation, or you can ask them to develop any hobby that divert their mind. So these are for the stress management. Okay, coming to the electrotherapy part, TENS has been suggested as an effective pain reduction modality in primary dysmenorrhea. Both high frequency and low frequency TENS, they are said to be effective. There was not a major significant difference when I talk about low frequency TENS and high frequency TENS, but yes, high frequency TENS shows a better and a lasting effect. So yes, every time a female is menstruating, she will not come to the clinical setup. She will not seek the help of a physical therapist for TENS. but then you can explain her the how TENS can help reduce their pain, or you can ask them to buy themselves a small TENS and they can use it back at their home, but again with complete precautions. Okay, coming to the exercise part, there has been a research done in 2016, which was a comparison of stretching or core strengthening exercises for managing the primary dysmenorrhea in 2016. So there were two sets of exercises, stretching and strengthening, which was performed to find out which one is better. And surprisingly, it was found that both of them have shown significant effect in females having primary dysmenorrhea. The stretching exercises, the half dog pose, calf stretch, or the side stretch has been effective. Talking about the core strengthening exercises, pelvic bridging, plank holding, cat and camel, and partial curl-ups. All these four exercises can be performed during your menstruation days. Uh, uh, a very common question that we come across in our practice is, are we supposed to do crunches during the menstruation days? Does it increase the bleeding? But with the partial curl-ups, with working on your core, you actually increase the blood flow to your uterine muscles. You actually relax your uterus, and a proper blood flow will definitely decrease the pain that is caused in your abdomen and your lower back. So it is completely safe to practice these core strengthening exercises even in your menstrual days. A few of the yoga poses that helps during the menstruation days is Ushra Asan, which helps relieve the menstrual cramps by stretching the anterior aspect of the trunk and also by strengthening the back region. It improves the flexibility of the spine. You can perform this asana 2 days prior to your menstruation days and during your menstrual cycle. Janosir Asan, it stimulates your reproductive organs and it therefore decreases your menstrual pain. It stretches your groin and hamstrings. It relieves the headaches, anxiety, and fatigue that you are experiencing during the 5 days of the menstrual cycle. And it also cures the insomnia that is induced by the menstruation days. Next is Dhanurasana. It stimulates the uterus and relieves the back pain during your menstruation. Again, it stretches the muscles of your anterior aspect of the trunk, ankles, and groin. It increases the blood flow to the uterus and it helps to keep your body relaxed. Again, completely safe to be practiced during the menstruation days. This was another study which was comparing the yoga asanas with a few exercises on the Swiss wall, and both of them were the results show that both of them were able to decrease the symptoms of primary dysmenorrhea, whereas the exercises on the Swiss wall show a significant change in the pain levels of the females with primary dysmenorrhea. So there are three exercises that we can do with the help of a Swiss ball. The first is the Swiss ball knee tucks. It helps to strengthen the muscles around your abdomen, legs and arms and back region. Improves your balance, stability and blood supply, which helps to ease out your menstrual pain. Next is hamstring curls. Using the Swiss ball helps to strengthen your glutei muscles. It improves the blood supply, the nutrient supply to your lower abdomen, lower back region, which helps to relieve your menstrual cramps. The third is the back extension on the Swiss ball, which helps to strengthen and provide stability to your lower back, gluteus, and your hamstrings. It again stretches and strengthens your core muscles. It improves the blood supply to your uterus, to your lower abdomen, which helps to reduce the menstrual pain. So this study was done in Chennai by K. Veena, and the It was to find out the efficacy of the yoga asanas and the gym ball exercise in the management of the primary dysmenorrhea. So during our light menstrual days, moderate intensity aerobic exercise like walking and light jogging are recommended. These type of physical activity can help reduce the bloating, the extra water weight that we feel around our abdominal, our belly, and it helps to decrease the pain of cramping. Aerobic exercise, they helps your blood circulation, they improves the blood circulation and the release of the endorphin, that is the feel good hormone. It works together to soothe your headache and improves the mood. So if you are experiencing uh, premenstrual syndrome, if you are PMSing, if there you are seeing a lot of mood fluctuations, you can definitely go for a walk or a light jog around your before or during your menstrual days. That will definitely help to improve the mood. The last but not the least, the most important part is the pelvic floor strengthening that we are supposed to do every day, not just the menstrual days. Before the menstrual cycle or after the menstrual cycle, we are supposed to strengthen our pelvic floor muscles. They are affected by the rise and fall of the estrogen throughout our menstrual cycle. So during your luteal phase, when we talked about that your corpus luteum has been generated, the progesterone levels are building up, your muscles are at their strongest, because now the agenda is to that the ova will be mating with the sperm. There would be a conception, the there would be implantation. So these muscles are preparing for the pregnancy. So they are the strongest during the luteal phase. But whereas by the end of your period, if the pregnancy does not take place, the estrogen levels falls and your muscles are at their weakest. You may feel slightly delicate if you have heavy periods, but still you can practice your pelvic floor exercises. You can do your pelvic floor exercises throughout your periods. They are completely safe. So normal Kegels exercises, that is contraction of your pelvic floor muscles and relaxation. You can begin with that. That is the first step of the Kegels exercise. Then you can progress to contract your your pelvic floor muscles and hold it for a 5-second count and then relax it. And you can progress it so on with the Kegels exercise. Next is exercises with the special devices, that are vaginal cones that are inserted inside your vagina with graded weights. This you can practice when you are not menstruating. After or before your menstruation cycle, you can practice, you can strengthen your pelvic floor using the vaginal cones. The one shown in the diagram in the photo is a perinometer. You can strengthen up your pelvic floor muscles with the help of a perinometer, again before or after your menstrual cycle. It is not recommended during the menstrual days. So pelvic floor muscles, they would help the pelvic floor strengthening. This was definitely help you have a better menstrual flow. If you are facing any problem during your menstrual cycle, if you are not able to hold on to your urine, or if there is any urine incontinence during the menstrual cycle, it would definitely be dissolved if you are practicing the pelvic floor strengthening exercises during your menstrual cycle, or before and after. So for every female, it is recommended to go for a pelvic floor strengthening exercises. So that brings us to the end of today's topic, that was menstrual health and role of PT. If you have any doubts, you can reach me on my WhatsApp number. You can follow me on my page of Active Motion. And if anybody wants, I have already quoted the articles from where I have uh, found out these exercises which are effective in the primary dysmenorrhea. They can definitely, if anybody has any doubt, they can reach me. And I hope as a physical therapist, we can definitely make some change in the women health in the society.
Absolutely, Dr. Tanvi, good evening. Uh,
Good evening.
it was a wonderful presentation, and I feel it is the right time that we educate more and more women about the good hygiene practices and if not good hygiene practices, but also educate them about the possibilities of lifelong care about menstrual health. And this is where, as a country of not not a lot of literate women, this is very much required in India. You have stressed a lot of points on lifestyle, and I really like that. When lifestyle issues are discussed, we generally talk about junk food, stress, lack of physical activities. And I think to start our education from these preventable aspects, you cannot change being a woman, but you can change your physical activity levels, your stress levels, the way you exercise, and what you eat. These things can still be controlled and can be made better for your own health. And very nicely and with pictures, you have explained the exercises that should be done. My only question to you is, are the exercises individualized or these are general exercises?
These are general exercises for anybody who is experiencing primary dysmenorrhea. Other than this, we have to actually assess if somebody says we are having a lot of, there is heavy bleeding during the menstrual cycle, or there is a lot of pelvic pain, then we have to actually assess the patient that is it actually the pain related with the menstrual cycle, or is it a pelvic inflammatory disease, or it could be endometriosis. So these are the general exercise that anybody can practice during the primary dysmenorrhea
Right, right.
and pre-menstrual syndrome as well.
Okay, fine. So it is important that discussing about and understanding the symptoms and then prescribing the exercises. But these are some general exercises that anybody can follow. Just another question was that whenever somebody is in pain, the best possible thing that they think is if they can rest. Uh, but you say mild physical activity is much more important and beneficial than just rest and hot pack. So, any take on that?
As I explained during the exercise process, when we are doing the exercises, when we are doing the normal aerobic activity, so we are increasing the blood flow. So with the exercises, those exercises we talked about were specifically increasing the blood flow to your lower abdomen, to your uterus. So this is the only reason which is easing out the pain, the decrease in your uterine contractions, the cramping.
Oh, thank you, Dr. Tanvi, for a wonderful update on menstrual health and role of physical therapy. Thank you for
So much,
being with
sir.
us.
Thank you, sir.
Thank you, Dr. Tanvi.